My name is Reeshad Buhariwalla. I'm a medical doctor who has just joined the Wood Health Corporation at Wood County Hospital. I chose to become a doctor very early in life. My father is a pediatrician, and I remember as a child where I initially grew up in India for the first 10 years of my life, and I remember going with him to the hospital, and he was a consultant pediatrician and he had a busy practice, and I remember on the weekends and sometimes in the evenings going with him to the hospital when he was called in. The field of medicine is quite varied. There are all sorts of different things doctors can get involved with, whether it's the radiology or emergency room or surgery. I always wanted to be a cardiologist. I was fascinated with the heart. I also wanted to be a psychiatrist because I was fascinated with human thoughts. But in my first rotation following a family doctor in my internship, I got to deliver a baby. I got to help give chemotherapy to a dying cancer patient. We helped set a young boy's broken bone. I got to help admit somebody who walked off the street in congestive heart failure, and I helped that night with a code blue. And I thought, why do I want to limit myself to the heart when I can do all sorts of different things? And that's when I decided being a family doctor or general practitioner was the only thing for me. I think the role of the family physician is so important in preventative care and in coordinating complex care on patients who have multiple specialists. I enjoy virtually most aspects of family medicine. I enjoy looking after newborns as well as 100-year-olds. When a new patient comes to my office, I examine them. I determine where they are in a disease process or in their life cycle, and in my mind try and envision how do I get them to 95 healthy, not paralyzed in a nursing home. And if we can die as healthy as possible, as late as possible, with as few complications as possible, then I think your doctor has done good by you.